If you toss your orange peel in the trash, you're probably throwing away most of the good stuff. Hesperidin, the citrus helper tucked into the peel and white pith, may be the quiet reason an orange does more than taste sweet. Let's talk about what it can and can't do, how to use it safely, and whether a supplement even makes sense for you. And as always, talk with a qualified clinician before starting or changing any supplements or medications. Quick summary first. Hesperidin is a natural compound from citrus that may support healthy blood flow, comfortable legs, and everyday antioxidant and inflammatory balance. It may also nudge cholesterol and blood pressure in a healthy direction, though effects are usually modest. It could help if you have heavy legs after long days standing, bruise easily, or want general circulatory support. You should avoid a supplement or get medical guidance first if you're pregnant or breastfeeding, if you have a citrus allergy, if you take blood thinners or medicines that interact with grapefruit, or if your doctor has told you to avoid certain plant compounds. One safety note: high-dose citrus extracts can upset the stomach, so start low and take with food. One simple action step you can do today: eat a whole orange or a clementine and include some of the white pith. If you already do that, try grating a bit of clean lemon or orange zest into yogurt or salads a few times a week. So what is hesperidin? It's a plant compound called a flavonoid. Think of it like one of the tiny tools plants make to protect themselves, and our bodies can borrow some of those benefits. If an orange were a toolbox, sugar gives quick energy, vitamin C is the flashlight, and hesperidin is a small wrench that helps keep tiny blood vessels snug and working smoothly. How does it work in the body? First, antioxidant support. Hesperidin and its active form hesperetin can help neutralize everyday oxidative stress, the normal wear and tear from living, exercise, and modern life. That doesn't mean it detoxes you, it's more like it takes the edge off the buildup of tiny sparks. Second, circulation support. It appears to help the lining of your blood vessels behave better by supporting nitric oxide signaling. Nitric oxide is a messenger that tells vessels when to relax. That can encourage smooth flow and help capillaries, those tiny pipes, stay sturdy. Third, calm the noise effects. Many studies point to gentle, broad support for inflammation balance, not a shut-off switch, just a nudge towards steady instead of jumpy. Your body can't make hesperidin from scratch. You get it from food. And then your gut bacteria convert it into forms you can absorb better. That means two lifestyle factors matter. Eating citrus or other flavonoid-rich foods raises your intake, and a healthy, diverse gut microbiome may help you get more out of what you eat. Sleep, fiber, movement, and lower stress tend to support that microbiome. Smoking and very low produce intake can work against it. Where do you find it? Start with food and daily habits. Oranges, tangerines, clementines, lemons, and grapefruit contain hesperidin, with the highest amounts in the peel and the white stringy pith. Fresh whole fruit generally gives you tens of milligrams per serving, while 100% orange juice has some, but usually less than the whole fruit. You can boost intake by eating the membranes in citrus segments, using zest from clean, well-washed fruit, and adding citrus to salads, oatmeal, or sparkling water. If you can't tolerate acidic fruit, a supplement is an option. Supplements typically offer standardized doses that are much higher than food, often a few hundred milligrams per capsule. Hesperidin isn't a vitamin, so there's no true deficiency disease. Think of it as part of your plant intake pattern. People who rarely eat fruit and vegetables naturally take in less. Smokers and those with chronic low intake of produce may have fewer flavonoids overall. There isn't a routine blood test for hesperidin, but if you're thinking about it for circulatory support, basic checks to discuss with your clinician could include blood pressure, a lipid panel for cholesterol, and general inflammation markers like CRP when appropriate to your care. Those labs don't measure hesperidin, they measure the bigger health picture it is often aimed at supporting. Here's what studies find. For vein comfort and leg heaviness, the research is fairly strong for certain citrus flavonoid mixtures that include hesperidin, especially when combined with a related compound called diosmin. Many of these are randomized controlled trials, often with dozens to a few hundred adults, showing improvements in leg feeling and microcirculation. For blood pressure and cholesterol, the research is mixed to promising. Small to medium human trials and pooled analyses suggest modest improvements, usually a few points on blood pressure or shifts in LDL, not dramatic changes. For antioxidant and anti-inflammatory support, evidence is early to mixed, with many lab and animal studies and a growing number of small human studies. For brain or mood benefits, research is early. Some small trials suggest acute mental performance or stress responses may change slightly after citrus polyphenols, but we need larger, longer studies. If you decide to look at a supplement, here's how to buy smart. Common forms on labels include Hesperidin, Hesperidin, Hesperidin methylcalcone, often called HMC and used because it dissolves more easily, and blends with diosmin. You'll also see citrus bioflavonoid complex, which may include hesperidin along with other citrus compounds. There is no official recommended daily allowance and no established upper limit for hesperidin. Typical effective dose ranges in human studies are about 250 to 1,000 milligrams per day, sometimes split into 2 doses. For blends that include diosmin, products often land around 500 to 1,000 milligrams total citrus flavonoids per day. Timing is simple. Most people take it with food to reduce stomach upset and improve comfort. If you're using HMC or micronized forms, absorption may be better, so you might do well with the lower end of the range. For quality, look for third-party seals like USP, NSF, or Informed Choice, which tell you the product is tested for purity and potency. For cost, a typical bottle of 500 milligram capsules might cost the equivalent of about 20 to 60 cents per effective daily dose, depending on brand and testing. Let's be clear on safety and interactions. Most people tolerate Hesperidin well. The most common side effects are mild stomach upset, gas, or headache when starting or at higher doses. Red flags that mean stop and speak with a clinician include rash, swelling of the lips or face, or breathing trouble, which can signal an allergy. If you have a known citrus allergy, skip it. If you're pregnant or breastfeeding, we don't have enough high-quality data on supplements, so choose food sources unless your clinician advises otherwise. If you take anticoagulants or antiplatelet medications, or if your medication label warns you about grapefruit, check with your clinician or pharmacist. Citrus extracts can share some metabolic pathways with drugs, and caution is wise. If you take thyroid medication like levothyroxine or certain antibiotics, separate hesperidin and any polyphenol-rich supplement by a few hours to avoid absorption issues. And if you have reflux, citrus foods can aggravate symptoms, so you may prefer a low-acid approach or careful testing with your provider. Who likely benefits and who likely will not? If you want gentle support for circulation, sit or stand for long stretches, bruise easily, or want to round out your plant nutrient intake, you may be a yes. If you already eat several servings of fruit and vegetables daily, feel great, and your numbers are on track, a supplement may add little. If you're hoping Hesperidin alone will meaningfully lower high blood pressure or high LDL cholesterol, that's a no. It might help as part of a broader plan, but it's not a solo fix. If you're on medicines with narrow safety windows, like blood thinners or certain heart or transplant drugs, don't start without medical guidance. What's new lately? 3 takeaways in simple words. First, more human studies are testing citrus flavonoids on everyday vascular function using non-invasive measurements. Results generally show small, favorable shifts after weeks to a few months, but effects vary from person to person. Second, scientists are paying attention to the gut. Your microbiome seems to decide how much hesperidin you actually use, which may explain why responses differ. Third, combinations matter. Blending hesperidin with diosmin or with vitamin C may produce steadier benefits than any single compound alone, but we still need larger, longer trials to know who responds best and what dose is ideal. Here's how to stack and time it with lifestyle. Pair hesperidin with vitamin C-rich foods or a multi that includes vitamin C, since these often show up together in nature and may support capillary strength. It also plays well with fiber from oats, beans, or flax, which supports the microbiome that helps unlock hesperidin. If you take iron supplements, separate them by a couple of hours because polyphenols can reduce non-heme iron absorption. Do the same with thyroid medication and sensitive antibiotics. Morning or midday with a meal is a practical starting point. If you drink a lot of coffee or tea, consider taking Hesperidin with a meal rather than with your hottest, strongest brew, just to keep absorption consistent. Here's a simple 30-second plan for different people. If you're budget-focused, buy whole citrus when it's in season. Eat 1 orange or 2 clementines most days. Keep the white pith. Grate a little zest into oatmeal or salad a few times a week. That's low cost and steady. If you're vegan and want extra support, still lean on food first, but consider a 250 to 500 milligram Hesperidin or citrus bioflavonoid supplement with lunch for 8 to 12 weeks. Then reassess how you feel. If you're on a blood thinner or your medication list includes a grapefruit warning, do not start a Hesperidin supplement until you've checked with your clinician or pharmacist. If they green-light it, use the lower end of the range and monitor for any changes they care about. Myth versus fact lightning round. Myth: Hesperidin replaces your heart medication. Fact: it's a supportive nutrient, not a substitute for prescribed care. Myth: you need to chew bitter peels to get benefits. Fact: the white pith and a bit of zest in cooking go a long way. Myth: more is always better. Fact: higher doses bring more stomach upset and not necessarily more benefit. Let's put it all together. Hesperidin is a citrus flavonoid that can support healthy circulation, capillary strength, and everyday antioxidant balance. It's not a cure or a quick fix. The best plan starts with food, especially whole citrus and a bit of zest, supported by sleep, movement, and fiber for your gut. If you choose a supplement, look for a tested product, start with 250 to 500 milligrams with food, and adjust slowly. Check with a clinician if you take medicines that interact with grapefruit, if you're pregnant or breastfeeding, or if you have any medical condition where new supplements could be an issue. We'd love to hear from you. If you've tried Hesperidin, what dose and timing worked best for your routine? And did you notice anything in your legs or energy after a few weeks? Drop your experience in the comments. Let us know what supplement you would like to learn about next.